Hey guys, welcome back to Quick Nursing Shots with Smitha, and today I'm going to teach you about inflammatory bowel disease. So inflammatory bowel disease is another condition under your GI disorder, and it is a very important question for 10 marks as well as for 5 marks, but 10 marks for sure. They like it's usually asked for 10 marks, okay, for GNM and BSc students, so it's very important. Do not take chance on this question. Do read this condition before you write your exam. So here you can see that the term inflammatory bowel disease refers to two chronic conditions, which are these Crohn's disease and ulcerative colitis. So these both disorder have some striking similarities, but they also have several differences. That is the reason I'm going to take these two conditions separately, but the management will be for overall Crohn's and ulcerative as management of IBD. Okay, so I'm going to take three different sessions about this IBD because it's a very long topic. So today we'll talk about Crohn's, then next day ulcerative colitis, and the third day we'll see about the management. So based on your question asked in your exam, if they are asking about inflammatory bowel disease, so make sure that you are writing Crohn's and ulcerative colitis both in your exam paper. If not, the question is asked like separately, maybe the Crohn's disease they're asking, or maybe they're asking for ulcerative colitis, so do write separately like that, but the management could be same. That's why I'm gonna give you management for overall IBD. So let's start today's session with Crohn's disease, and it's since it is a inflammatory intestinal disorder, so here you can see that the inner lining of the intestine is being inflamed and infected. So due to this inflammation, this patency here of the lumen, that is being reduced. Okay, so there will be reduction in the patency of the lumen, and the lumen will get thickened. There will be less space in the lumen for the food to pass or air to pass or any fluid to pass. Okay, so that will cause the problem which is called as Crohn's disease, and the symptoms will be depending on these conditions. Okay, so start with the definition. Definition says that it is a chronic and non-specific inflammatory disease of the bowel that occurs most commonly in your terminal ileum, jejunum, and colon. So this is a disorder which is where the inflammatory process will happen in your terminal ileum and colon. Most often it happens over there, and then it also says that since it is a GI problem, so it can affect any part of your GI tract, but most commonly we have seen only happening in ileum, jejunum, and colon. Okay, so moving on to the etiology, so the risk and the causes behind this problem is not being found, like what is the exact reason. But yeah, we have seen that the people who have this autoimmune reaction, or it means that the person whose immunity itself is destroying their body healthy cells and causing their immune system to become vulnerable and kind of reduce or decrease immunity in those kind of people, so they are prone to get this problem. Then genetic, if there is a gene of these disease running inside the family generation, and then anybody in the family can get this problem if it is anybody has. And then the risk factor says smoking. So smoking and alcoholism, it's the main cause of having any other digestive problem. So yeah, smoking doubles the chances of developing Crohn's disease, and also the intake of several medicines like NSAIDs, antibiotics, and birth control pills. So there are some studies they have shown that the people who take these kind of medicines on a long scale, then they are little prone or slightly prone to get this Crohn's problem. And also your diet. So your diet having rich fat and also more of cholesterol. So this can cause thickening of your intestinal wall. Later, the same problem will happen. So moving on to the pathophysiology of the Crohn's disease. So you can see here we start with the very due to etiology and risk factors. So yeah, there will be some microbial and dietary antigen entering your intestinal mucosa, and once they enter into your intestinal mucosa, they start interfering with your intestinal wall or your bowel wall, and then there will be inflammatory process, that is our own body's uh, immune reaction towards any kind of infection happening in the body. So there will be a physiological inflammation. So what happens in a normal person or a normal host, when this physiological inflammation happens due to any infection or any sort of small infection, So it becomes a kind of there will be some healing process also going on due to that inflammation. So in a normal host, this inflammation will be very limited, and that limited inflammation will be healed properly with no such a tissue damage. Okay, so there will not be much tissue injury. Whereas in a susceptible host, or you can say the vulnerable person who has this genetic problem and also the environmental factor, so in those person whose immunity is less, there will be uncontrolled inflammation due to that infection and inflammatory process, and that will cause an extensive tissue injury which is not good for the body, and that injury will take your intestinal epithelium, your intestinal wall, submucosa, everything will be affected, and then the Crohn's disease will be developed. So this is how your Crohn's disease develops in a body mechanism. Now, moving on to the clinical manifestation, so it has seen that the manifestation or the symptoms is characterized by a period of remission and exacerbation. So, what is a remission and exacerbation? So, remission is actually a good sign in the medical field. You can see that the person's symptoms are subsiding, that is called as remission, but exacerbation is again an opposite of remission. Exacerbation means becoming advanced or more extensive or worsening in the condition. So there will be a period where the symptoms will be subsided for a while, but again the symptoms will come up with more worsened condition. Okay, so this happens in Crohn's. Then there will be a prominent lower quadrant abdominal pain. So the person has a prominent or severe persistent right lower quadrant abdominal pain because your ileum and colon is in your right side of the abdomen area. Okay, and then the diarrhea. Diarrhea is one of the commonest signs and symptom in this Crohn's disease or in the inflammatory bowel disease. Okay, so yeah, the person will have diarrhea, and that diarrhea too, it will be severe diarrhea, like for 15 to 20 days the person will be having diarrhea continuously. And due to that diarrhea, because the intestinal motility has been increased, so there will be a crampy abdominal pain. And also because your intestinal lumen, which has got decreased or has no much space for the food to pass through it. So when you have this peristaltic movement in your intestine, the food has to move forward in the direction. Okay, so in at that time, wherever is this site where the infection and inflammation has occurred, so only in that area the lumen of the intestine is being reduced, so the food from that passage to move forward is become little difficult. So that is the time when your food due to peristaltic movement will be pushed on that narrow lumen of the intestine, causing too much of pain to experience for a patient. Then abdominal tenderness and spasm due to same reason. And also it has seen that after eating food the person experiences more pain, so it happens due to the same reason of intestinal peristalsis. So peristalsis causes food to move in the forward direction, and then the obstruction will be pushed down, and that will cause a severe pain. Then weight loss. So what happens when the person realizes that even only after eating food I'm experiencing more pain, so by themselves they will think that okay, I need to stop eating, and then they will get a mindset. Okay, so this is what we do when we know that okay, this is caused by this issue, so we try not doing that thing. Okay, so here in these Crohn's disease, the person will try avoiding taking intake or taking food, and that will cause a weight loss. So not taking much nutrition and adequate nutrient to your body, there will be a malnourishment, and that malnourishment will cause you secondary anemia. And there is also a chance of anemia due to bleeding, that is internal bleeding. When the intestine has perforated and there is ulcer formation, there will be a bleeding inside, so that will also cause anemia. And then disrupted absorption. Why there is a disrupted absorption? Because a chronic diarrhea means persistent continuous diarrhea. So diarrhea is something where your body or your digestive tract doesn't get much time for the food what you have eaten to get absorbed and metabolized properly. So whatever you eat, immediately it goes out in your fecal as a fecal matter, and you defecate in diarrhea. So there is no much time for the digestion system to take place, so there will not be absorption of minerals. So that is the reason behind disrupted absorption. Then nutritional deficit, same reason. When there is no absorption of minerals and nutrition, there will be nutritional deficit in the person body. Then constant fluid loss because of diarrhea, and severe diarrhea will have more of your electrolyte and fluids loss. Then inflamed intestine may perforate. So yeah, there is always a chance of perforation because the inflammation keep happening. And the intestinal wall, you know that intestine is a small lumen already. So when there is any inflammation happening, so there is a chance of perforation to occur, and that perforation may lead to anal abscess or maybe a intra-abdominal abscess. Okay, and so when there is an infection in your body, you will have hyperthermia and fever, and that will cause leukocytosis. Now the chronic symptoms, since it is a chronic problem, so there will be symptom for a long term. So the person will experience diarrhea for a long period of time, abdominal pain due to diarrhea. Steatorrhea is another medical term which means that there is a presence of excessive fat in the feces because the fat is not being absorbed in the intestine and the abdominal wall. So these fat will not remain in your body and it will just come into your feces as such. So there will be increase presence, there will be increase excessive fat presence in your feces, that is called as steatorrhea, and it is being ruled out by examining your stool. Then anorexia, that is a loss of appetite, same reason, person will not be eating any food, so there will be anorexia causing weight loss and nutritional deficiencies. And abscess due to intestinal perforation. Anal fistula and fishes are two very common complication having in this Crohn's disease. Okay, so what a fistula and anal fissure means, I'm going to take another class on few of these terms which is usually asked for 2 marks, so I'm not going to waste time here. So we'll see in the other slide some other day. So yeah, so other symptoms which extend beyond the GI tract, it means that not only the GI tracts are or not only the GI tract is being affected, but other than your GI tract or your gastrointestinal tract, your other body system is also being affected in your Crohn's disease. And this is a peculiar symptom of your Crohn's disease and your ulcerative colitis. So do remember these four symptoms in your exam and do write it because you're gonna get marks only on this. If you write, if you mention these, you will definitely get full marks. Okay, so this involves joint involvement, which means arthritis, skin lesion, a kind of skin lesion which is exactly erythema nodosum, ocular disorder which is an eye disorder, that is conjunctivitis, and oral ulcers. So people who have digestive tract problem or ulcers or intestinal perforation, so these people are very prone to have this oral cavity ulcer. You can see that they often get these ulcers in their mouth if they're experiencing gastritis and all. So yeah, this is all about the signs and symptoms. Moving on to the complications, so first complication is intestinal obstruction. So why a person get intestinal obstruction? Because here the inflammation is happening in your intestinal wall, and that inflammation will increase day by day due to proliferation of bacteria, and then the lumen of the intestine will lose its patency and there will be a kind of intestinal obstruction made, and due to that inflammation and obstruction the food will not pass, and later on the person may have to get a colostomy done for this reason. Then stricture formation, there is also a chance of stricture formation because of it. And then perianal diseases like your fistula and fissures. Then fluid and electrolyte imbalances, because the person experiences diarrhea for a long period of time, since it is a chronic problem, so chronic diarrhea will be experienced, and due to that there will be chronic fluid and electrolyte imbalance. Person will be having a persistent fluid and electrolyte imbalance in their body. Then malnutrition from the malabsorption will happen because of diarrhea. The food is not being absorbed properly, so there will be malnutrition and the person will lose their weight very fast. Okay, so they will be losing their like 3 4 5 6 kg of weights in a short period of time. Okay, then anal fistula and abscess formation is also one of the complication of Crohn's. When there is a chance of perforation to happen, there will be abscess formation. yeah, so this is it about complication. Now moving on to the assessment and diagnostic findings, starting with our very history collection. So collect a detailed history about persons intake of food, their family history, if they have any genetic or family history of that Crohn's disease, and then take their medical history, what all the medication they are on and what all the condition they have had earlier in their lifestyle. And if it is a woman, then ask about their birth control pills if she is taking, or for how long she has been taking that. So these all the things will be collected in your history collection regarding the patient diet as well, as we have seen a high fat diet causing this problem. Then physical examination includes your you have to watch for the palpation, percussion, auscultation and inspection of the abdomen area. You need to see how distended the abdomen is, need to ask the patient by touching where like to show where the pain is exactly and what kind of pain it is, whether it is acute pain or it is a chronic pain, or it is happening all of a sudden, or it is keep on having on that area, and when and where the pain is radiating. So all these things will be asked under physical examination, followed by proctosigmoidoscopic examination. So this is a procedure where we are going to visualize our rectal inside the rectosigmoid area, so just to rule out if there is the inflammation has spread over that area or not. Then stool examination is performed to see if there is a fat presence in the fecal matter, so it means there is a malabsorption happening inside the intestine. Then barium study is also done in this case to show the classic string sign on an X-ray film of your terminal ileum, since this problem is having occurring in your terminal ileum. So we need to perform a barium study to rule out that, and endoscopy is performed to visualize your intestine and your is from your esophagus to intestine. Then the intestinal biopsy. Here in this case, why we are performing biopsies? Because you know that biopsy is being performed in cancer cases. So yeah, we need to see and we need to find it out on in earlier stage whether it is a cancer, when whether there is a chance of cancer formation in your body or not. Since it is an ulcer formation and abscess formation, these ulcers can anytime turn into a cancer. Then barium enema is performed to see if there is any abnormality, obstruction or any fistula or fissure presence. Then CT scan to show bowel wall thickening and fistula tract. We need to find out how thick our bowel has become or the intestine has become, what is the patency. So these things will be ruled out by CT scan. Then CBC is a complete blood count um, which is seen to identify your hemoglobin level. There is a chance of anemia and also bleeding, so hemoglobin level will be decreased, and also there will be an alteration in your fluid and electrolyte, so that level will be ruled out by the blood test. And albumin and protein level will also be decreased because there is a malnutrition and malabsorption. Then so yeah, this is it about the it about the Crohn's condition. And the management part I'm going to take in the third session, so this will be taken after the ulcerative colitis is done. So yeah, so I hope you guys enjoyed this video and this was helpful for you. So do like, share and subscribe to my channel. If you have any query or any doubt regarding anything in your nursing study, you can just comment down and I'll be helping you. So yeah, till then, study well, and so happy e-learning. Bye bye.